Good afternoon, everyone. Welcome to today's lecture. May I remind everyone to mute their microphones, except for Dr. Jawad, of course. You may ask your questions at the end of the lecture, or you can type them in the chat section, and Dr. Jawad will answer them later. Today's speaker is Dr. Jawad Abulhasan. He has a PhD in sports physiotherapy from the UK. He's the co-founder of Kinesia Clinic. He has 14 years of experience in treating sports injuries and joint pain. Today's topic is fundamentals of athlete rehabilitation. Friends and colleagues, let us welcome Dr. Jawad Abulhasan.
Hi everybody, thanks for the invitation, and I hope you're all having entertain ourselves with this talk about the basic simple fundamentals of exercise prescription. It was an honor to be here, and hopefully everybody will enjoy and learn something. As we know, we always learn day by day, and always good to go back to the basics, of course, frequently, just to refresh our minds. Today, my talk is about fundamentals of rehabilitation. The title said that it's not for athletes, but not surprisingly that this can be applied to any patients, even elderlies with different problems, orthopedic problems, cardiovascular problems, or even neurological problems. So exercise, as you know, is the key fundamental way of treatment in physiotherapy. And I think it's the best way to interfere with any patient, regardless of his problem, which muscle or which source, which joint. So I think the basics applies to everybody, even pediatrics or even geriatrics. So let's try to refresh our mind with some fundamentals about what we need to do with our patient athletes or even recreational exercisers, or also post-op patients. So this is what we are going to talk about. It's going to be a short, hopefully on to the point slide, and we can hopefully I can interest you with some knowledge about what I'm doing in my daily practice here in the clinic. So yeah, let's start. First of all, I want to go through the objectives of this talk. We'll touch base on the fundamentals of exercise prescription. What should we know and what we should focus on when we are prescribing an exercise is number one. The second objective is we'll talk about the concepts. So the theoretical concepts, why we need to do rehab, what we should include in our rehab. So we'll also touch base on the concepts of rehabilitation. Thirdly, we'll talk about how we can progress or regress an exercise, what we think is important in terms of progressing or regressing an exercise. And the fourth objective is the communication with athletes, patients, exercisers, professional, recreational. So communication skills and what ways we can communicate with our patient as a healthcare provider or as a team of a healthcare provider. So communication is important, as we know, and we will touch base on that too. Finally, we will talk about take-home messages. So what we will learn and what I suggest and recommend as a take-home message, and so that we can apply them tomorrow in our daily practice. So those are 5 fundamentals we will focus on, and hopefully we will refresh our mind with them. Okay. First of all, the foundation of exercise prescription. So what we need to do, or what are the foundation of exercise prescription? First of all, we want to define physical activity. What is physical activity? It's any activity that a person can do that elevates heart rate. So 15-year-old gentleman can walk and run, then this is a physical activity. And 80 years old man can just walk or do sit to stand, is also a physical activity for him, for his condition or for his age. So physical activity, basically any level. So when we are talking about prescribing physical activity, exercise, we are covering all the population sample here. Secondly, if we want to prescribe an exercise, we need to have an outcome measure so that we can monitor the difference between time. Let's say we have an outcome measure, pain. We want to compare it with the time that we are exercising or prescribing that exercise specifically. So we need to have an outcome measure to monitor, not just arbitrary or assumptions. We don't base on assumptions our prescription of exercise. So those are important 2 points we need to focus on. Thirdly, of course, as you know, all our work should be based on evidence-based practice. We should not do anything without an evidence-based. So evidence-based practice is very important, as we know, but the problem is that we don't adhere to those things. This is all theoretical, all we learn in our school, in our university, during college. But the problem that what I think right now, not everybody is using those foundations. We need to stress on those things because this is basic science. We need to do something based on evidence-based practice. We need to do some outcome measures to prescribe an exercise. We need to define what is physical activity for any kind of persons. Fourthly, quality of life. The ultimate aim of those exercises that are prescribed or that will be prescribed by you to improve quality of life. Quality of life for an elderly is just to do his daily activity, to run or to walk for a few minutes, to go outside and walk in the park, for example, or talking internationally, or just an athlete who wants to improve his quality of life in terms of every aspect, performance, daily activity, so it covers everything. So quality of life is a goal that needs to be achieved when we are prescribing an exercise, not just an exercise to benefit from specific thing, just to do some performance activity, doing competition in a club. No, this is need to be generalized and focus on everything, not just the performance of a patient, of an athlete, of a recreational exerciser. No, it should be on quality of life of everybody. And the next one is the function. We need to have a better function because a lot of people now are not doing their function physically function. They can't climb stairs. They can't walk for half an hour. As we know, it is an important task and a function that we need to do daily in order to get a better and improved physical function. And of course, the ultimate aim of all this, all exercise prescriptions, why we do this, just to reduce pain, of course. So people come with pain, we need to prescribe an exercise to reduce those pain levels. So those are 6 points we need to focus, and they are the fundamental exercise. One of many. I just listed 6 that I think are important for any patient, any athlete, any exercise professional or recreation. So those are the things I think are fundamental for any exercise that we prescribe. Secondly, we'll shift gear to the concept of rehabilitation. We talked about in the previous slide on the exercise prescription. Now let's talk about the rehabilitation, because we can give an exercise, but we need to govern that in a complete rehab program, rehab protocol. So what are the concepts of rehabilitation? Those are very important, but of course, everybody might know, but we are not doing them in our daily practice. My ultimate goal here is to emphasize on that, to stress on that. We need to do them. Knowing them is not enough. We need to recruit those concepts. We need to apply those concepts. So first concept I think is when we do a rehab program, we need to do the strengthening to the failure threshold. For example, we have to let the patient do, for example, biceps curl until failure threshold. So if he can't do more than, of course, the number that he can do. Let's say he can only do 10, then we should reach 10. If he can do 15, we should reach 15. It depends all on the needs. So we can increase the weight, increase the volume, increase the intensity. So the exercise should be focused on the failure threshold, because research will support that this kind of activity that reach failure is the most beneficial for every patient, for every athlete, for every exercise. So strengthening to failure is a must, in my opinion. Secondly is sufficient technique and psychological preparedness, so readiness. Everybody should have sufficient technique. That's why we need to supervise our patients. We need to supervise our athletes in our daily practice. We don't just give them exercise and escape and go away and come back to them after a few minutes. No, we should focus on that and supervise them so that we can get a sufficient technique. Because exercise without sufficient technique, I think it's not an optimum way to prescribe a rehabilitation. Thirdly, gradual tissue conditioning. So we need to listen to the muscles, ligaments, tendons during our rehab. Gradually, we improve the outcome of those tissues. We start with minimal tissue loading, then we increase to the maximum. So gradual tissue loading is a must. Lots of times we see a patient that they start with heavy loading. So that will affect the tissue itself. So gradual tissue conditioning is a must. Next is the training variation to prevent overuse injury. We all need to use our tools and variation of exercise and training. We shouldn't focus on one simple thing. Right? Training variation we should do because we are fit to prescribe those variations. Agility training, strength training, endurance training, explosive training, a lot of training variation. We should utilize them and get away from overuse injury. Because a lot of patients came to me and they do the same thing every day without any variation to their exercise regime, exercise or rehab protocol. So we need to do some variation on that. Finally, is the protein intake. As we know, muscles are all dependent on protein. So if we are need to improve muscle strength, we need to give the muscles what needs. So total protein intake is important, and all the strength and conditioning coaches, physiotherapists that have an interest in nutrition, they suggest 1.6 gram of protein per kilogram per day. So this is I also recommend, because we don't want to give a lot of exercises and then we don't give the muscles their needs. So those are concepts of rehabilitation that I think are important and need to be applied. Maybe we know them, but we are not applying them, unfortunately. I think so. Next is the variation. We talked about variation. Let's talk about type of resistance. We can do isometric exercises, we can do isotonic exercises, we can do isokinetic exercises. Those three types are important, but unfortunately, we are not utilizing all of those three. We all focus on give exercises like isotonic, where you can ask the patient to lift, for example, 2 kilogram dumbbells and do some repetitions. Yes, that's nice and correct, but we need to do some more. We need to use all the three ways of resistance. Isotonic, isometric is all important, and isokinetic, of course, if we have the machine itself. So using all those kinds are important, because each muscle will get benefit from different way of resistance. So that's why we need to apply more than one type of resistance. Second, the contraction. We should do some exercise as a concentric and eccentric. Both are important. A lot of people, a lot of friends are doing a great job, but we need to stress on that, not just concentric, not just eccentric. Both are important, both are needed to be applied. We know them, but we don't apply them as frequent as we should. And of course, mode of supervision. It's very important. We need to supervise our clients, our patients, in every single session. And every exercise intensity. We should establish our 1 RM, 2 RM, 3 RM. So we need to have a number so that we can compare later on with our next sessions. I suggest 8 to 12 repetition per resisted maximum. So I establish my maximum weight, then I will do the 8 to 10 repetitions. So what is the weight that I can lift? 8 to 12 repetition max. So this is very important. We have to establish our RM in every single exercise. Of course, the frequency is 3 times per week. This is what I suggest, because we give 1 day off, 1 day training, 1 day off, 1 day training. This is basic concept we need to apply, not just because a lot of patients come to us and they only come once or twice per week, and they don't do anything later on. So I think that's insufficient. Should minimum 3 times per week. And the volume, of course, 8 to 12 repetition, 4 sets. This is the strength and conditioning recommendation. Sport physiotherapy bodies recommend all those things. Why not 3 sets? Because we need to put the muscle under micro trauma so that it can build itself later on. So those concepts are important in terms of rehab. Type of resistance, type of contraction, supervision, the intensity, frequency, the volume. We should establish our RM. This is very important, basic knowledge, simple, basic science, but we don't apply them, unfortunately. We need to apply them. This is what I think. Progression and regression when exercise, of course, we need to progress for sure to get high training load to reduce the injury level. As you can see here in the figure, we should focus on the sweet spot where we can reduce an injury and not going all up where the dangerous spot is there, where we have an increased injury risk. So it's the ratio between the acute and chronic load. When we do some acute exercises, when we do some high intensity exercises, and when we rest and do some recovery. We have to have a balance for those things. It's very difficult to choose and choose an exercise that is on the sweet spot, but this is the target, this is the aim. We have to apply that. We don't regress and we don't just stay on what level we started with. No, we need to progress and regress if that is needed, where the patient or athlete comes to us and says, I'm exhausted, I didn't sleep well, my bodies are tiring. You think and you feel that there is a need for regression and recovery time. So we should be dynamic, not just one single exercise prescription, single intensity, single frequency. No, we should be dynamic. Either we regress or progress, depend on the patient itself and the outcome of the feedback of the session. So, fourth thing is the communication. I think this is one of the most important things we need to focus on, because if you have a good communication, you will deliver your knowledge. The patient, athlete will listen and get a lot of benefits. So, instruction between the teamwork, as we said in the beginning, healthcare provider or a multi-approach team that contains surgeons, athletes, nutritionists, strength and conditioning coaches, psychologists, all the teams. So communication and instruction between everybody to deliver what we need to give for the patient. And secondly is the supervision. I think supervision will give you 40% better outcome. 40% better outcome. This is what the research suggests. If we supervise every patient, because we will correct the technique on each repetition, on each set, on each round. So if you do this, you'll get a 40% better outcome, as opposed to just giving the exercise for the patient and let him do it by his own, either in the clinic or at home. So, thirdly is the written material. We have to document something. We have to document what we did for the patient so that we can learn later and compare and contrast the outcome of each session later on. So written material is important, I think. We cannot, because how you can communicate between the other team healthcare providers without, not just by verbally, not just by phone call, not just by WhatsApp messages, not just by verbal talking, no, it should be documented so everybody can read and see what you have done. Fourthly is the diary of each athlete or patient. What did he do at home? What did he do in terms of activity? How many minutes he walked? How many minutes? Because those data will help. And when you get data, you will get benefits, and you can build your session gradually and improve the intensity and frequency. So you need data also. You can't rely just on yourself, on your session, because you'll do the session for 1 hour. So this is 1 hour out of 24 hours. You have another 23 hours, you don't know what the patient is doing. So you have to do some participant diary where you can monitor everything as much as you can. And of course, the regular follow-up. In case the patient gets benefit and discharged, we need to do some follow-up after a month, 2 months, 3 months, but we have to get a way to know what happened to the patient later on after he is discharged. So this is a communication, high-level communication, where we interact between the patient and the other healthcare providers in several ways. Documented, supervision, instructions, teamwork, or regular follow-up even after the discharge. So those are the communications that I think are important. So finally, take-home message, we need to focus on those things. Foundation exercise, as we said, what is physical activity and how we should do it. Concept of rehabilitation, including all the aspects of contraction, eccentric, all the resistance modes, isotonic, isokinetic, isometric, all important. You should be progressing and regressing your exercise dynamically, not just focusing on a single uh, volume or intensity. You should be dynamic based on the factors that you are facing during the session. And last thing is the communication skills. We need to apply them. I know those are theoretical things, but unfortunately, not everybody is applying them. My whole point is here to emphasize on stress on we need to apply those things because those are basic simple science in the physical therapy that you get benefits from, and you will help the patient better outcome and better feedback from your session. So applying those basic science fundamentals of physical therapy in terms of exercise prescription, I think will help you much better. And knowing them without applying them is the problem, I think. So focusing on this, I think are things you might do in your daily practice starting from tomorrow. So yeah, actually that was my talk about, and those are the fundamentals that I think need to be adhered and applied in our daily practice, regardless what is the patient, if he's an athlete, elderly, geriatric, pediatric, anything, any kind of patient, you can apply those concepts for them. So yeah, thank you for your listening, and more than welcome to answer any question if you have. Thank you.
Thank you, Dr. Jawad. If anyone has a question, you may ask now, or put in the chat, so I will unmute you.
Okay.
Actually, Dr. Jawad, I have a question actually, but I missed that part actually. I think something about loading. There was a curve about the sweet spot. It wasn't that about the sweet spot. There's a curve.
Yeah.
Yes. Progression and regression. Hey, how will I know the sweet danger? Yani, how will I know that I'm overloading my patient?
Yeah. You need to establish something called workload ratio. So the workload ratio is what is the percentage of acute workload to chronic workload. Acute workload refers to your daily session, your exact session. Chronic workload is the patient's daily activity. For example, if he is doing an excellent session with you, but he is going back home and resting all day, then the acute and chronic workload is different. So you need to observe this ratio. For example, if an athlete you are doing with, if a patient you are doing an patient that comes to you and you are applying a great session with full intensity and full volume, full repetitions, and he is doing great. And when you go back home, he plays football with his friends. He walk a lot. He go out with his friend and he plays another game at night. So you should work and see this acute chronic workload ratio, and you find the sweet spot depending on the factors that you are getting. What is the patient recovery time? What is the muscles that are being targeted? Is he trying to train the, let's say, the biceps daily? You should stop him. So you should regress that based on your basic concepts of rehabilitation. So my take-home message from this slide is monitor the workload ratio. So your workload here in the session and the workload of the patient when he goes back, and you compare and balance them. if he is too sedentary, let you ask him to do some exercise also when he is at home or going from the session. Or if the other way around, he is not sitting, he's not recovering, he's not doing any kind of conditioning or recovering and resting, then you should prescribe this condition for him. So yeah, that's what I meant in this slide.
Thank you, doctor. Thank you. Does anyone else have further questions? Anyway, some of the people will probably watch the broadcast late because we are recording it. And if ever, we will be forwarding the questions to you, doctor. Once again, that wraps up our day. And on behalf of the Physiotherapy Department of Ibn Sina Hospital, I'd like to convey our thanks and appreciation. Thank you for your time and effort, Dr. Jawad, and thank you to everyone who attended today. Thank you, Dr. Ekan. Bye-bye. Bye.